Well, hello, and welcome to the Learn webinar series. My name is Maureen Mcbeth, and I'm the Key Accounts Specialist for Rehab with Lipedema. Today's webinar is titled Shared Decision Making, How to Advocate for Yourself and Others for Better Lymphedema Care. I'm joined by a great group of faculty, and we're here because we want to recognize patients, caregivers, and advocates for working to improve the lives of millions of patients living with lymphedema worldwide. Lipedema has a long history in lymphedema care with both novel technology and in clinical studies. Today, though, you'll hear from three panelists who have been instrumental in helping improve the journey of many patients and are innovators in the care of patients with lymphedema and preventing chronic lymphedema in cancer patients. We look forward to an engaging webinar today. This will be a panel discussion, and we welcome all your questions. So now I would like to go to the next slide. And sorry, there we go. And we do have an important disclaimer. Learn sponsors these information, and it's for you to use in consultation with your healthcare professionals. It's not meant to take the place of any healthcare services you may need. And please see your primary healthcare provider about any personal health concerns. So again, even though we're healthcare providers, we're not here to give you personal information today. Please take it back to your team. So now I'd like to have the participants today tell us a little bit about yourself. Their bios are up there, but they're going to not read that to you. So Julia, go ahead.
Thank you, Maureen, and good afternoon to everybody. Thank you for joining us this afternoon. So yes, I'm Julia Osborne, and I'm a physical therapist and certified lymphedema therapist. And I became passionate about treating the oncology patient population in 2002, shortly after I moved to Denver, Colorado from South Africa. So if you're hearing an accent, that's where I'm from, South Africa. And as I began to grow in my practice, I realized very quickly that managing patients' lymphatic systems and indeed making lymphedema risk reduction a cornerstone of my practice needed to be very, very important. And so to this end, I founded Oncology Rehab, which is an outpatient oncology rehabilitation practice here in Denver, Colorado in 2009 to do just that. And in 2014, I founded PORI, which is my Oncology Rehabilitation Teaching Institute to teach clinicians also about treating patients with oncological needs as well as managing their lymphatic systems. So that is a little bit about me, and you'll hear from me again a little later in the webinar.
Chris, it's your turn.
Well, first, I just want to say I'm honored to be here, especially with gurus like Denise and Julia, who I've followed over the years and listened to many of their wonderful talks that they've given. So again, I'm honored. And just the fact that Learn has given us this platform is a great again, it's honored to be here. So me, I am an OT, an occupational therapist. I'm an old person. I've been practicing since the 1990s, and I've been doing cancer rehab all this time, and I'm lymphedema certified. I work in a hospital outpatient setting where my specialty is, again, work with breast cancer cases and all the cancer side effects that they get from fatigue, neuropathy, just strengthening issues, scar issues, as well as the lymphedema side of me. I treat all lymphedema and all edema patients, whether it's head and neck, legs or arms or body issues with all kinds of swelling issues. I work in an outpatient lymphedema clinic where we have 7 lymphedema therapists, being both PT, OT, and speech. So I'm honored to have worked with such a fabulous supportive group with that. And our approach in treating lymphedema, we do the gold standard of care that we hear so often about with lymphedema, but we also are an eclectic viewpoint. So we use a lot of the latest and the greatest tools and equipment that's even out there to kind of always give us that one step edge to just do one little bit better with treating lymphedema. We are currently working with expanding our practice to now incorporate more what we call cancer pre-rehab, which I know Julia and Denise are very involved with in their practice. And so we're kind of growing that area of our clinic. And so it's a learning curve for a lot of us, and working with the physicians and oncologists on that aspect. And it's nice to see overall oncology arena moving to a pre-rehab or a prospective surveillance model, or the one thing that Denise and Julie is going to talk about later. So again, I want to just thank you for allowing me to be a part of this.
Thank you. All right, and if I get my slides to work here, Denise.
Thank you, Maureen, and hello, everybody. I am truly honored to be a part of this fabulous team of exceptional providers. My story is a little bit different. I am not a lymphedema therapist, but I am a physical therapist of 27 years here in Fort Myers, Florida. I work for the Lee Health System and started out my career in various settings, not oncology specific, but actually grew to work with a lot of the breast surgeons in our hospital setting and developed some programming within the hospital. And then our system took on an education program which allowed us to educate clinicians in cancer-specific rehabilitation. And we had what was called a nurse navigator, and they would try to find, what it is that patients needed, and then connect them to the correct disciplines. And that proved to be really challenging under the nursing platform. So it was handed over to our rehabilitative service line. And that's where I had the opportunity to be selected to be the Rehab Navigator, which, as a physical therapist, identifying those aspects of impairments and functional limitations really allowed us to overcome a lot of barriers that we had in connecting patients. So we here at Lee Health have actually grown into 10 outpatient rehab facilities that have cancer-specific clinicians who are trained. I myself work in the Regional Cancer Center, which is primarily just oncology. My role as a Rehab Navigator allows me to provide a non-charged rehab appointment to where I can sit down with patients either in person or over the phone and really evaluate where they're at physically, nutritionally, emotionally, and then triage them to the correct disciplines to help address those needs. And I coordinate our breast cancer related lymphedema surveillance program, where we do baseline measures prior to surgical intervention, and then at every 6 months for 2 years for our high risk patients, which also provides an amazing opportunity to continue to surveil patients and identify needs for additional rehabilitative services. So I'll talk a little bit more about what that flow looks like, but it is truly a multidisciplinary approach. And I'm just very excited to be able to have this conversation with everybody and open up that line of communication to help patients be an advocate for themselves to provide that education. So thank you.
Thanks, Denise, and thanks everyone. My name is Maureen Mcbeth, and some of you may know me through other webinars that I've done. I've been a longtime supporter of Learn, and I've been working for Impedimed now since January. But prior to that, like the rest of our panelists, I have a lot of experience as a physical therapist, 20 some odd years, and have been a lymphedema therapist since 2004. And I like to tell people that's when my life really changed, when I finally learned about this lymphatic system. And it really is a most amazing system in the body that we still don't know how it all works. There was a bunch of NIH webinars the past 2 days that were just amazing, kind of mind-boggling to think how much we still have to learn. But what it came down to during that, and even why we're here today, is that all of us have a great passion for connecting with patients and for patient advocacy. So we want to get into that right now. So we actually came up with some clever learning objectives, right? Learn, I really love what that stands for and the dual name that it really has. So in terms of learning today, we really want you to come away from this feeling like your own navigator, really knowing how to work that multidisciplinary team. I wish I had a penny for every time I heard that today, because I would have had a lot of money. Everyone's now talking about that. Then we want to explain, be able to explain the concept of what shared decision-making it is and how it applies to your lymphedema treatment. We're going to go through that. I'll actually put the definition up. We want you to recognize the role you play in making Learn stronger and what resources it has. And to paraphrase what Bill Rapisi, the executive director of Learn, said today, is that you can't win the fight if you're not in the fight. So you have to join the fight to be part of it. We really want you to understand how important Learn is for that. And then, of course, we want you to be able to name 3 things that you could do to enhance your lymphedema care through, better communication with your medical team. And so if you do have a piece of paper, I would perhaps get it out so you could take some notes today. So what is shared decision making? And this is, of course, I went to Google to get this. And you can read it right now, but it's a key component actually of patient-centered healthcare. And this has been something we've been talking about for many years. And it's a natural process where the clinicians and the patients together make the decision, decide what tests are going to be done, what treatments, and come up with a care plan. And we use clinical evidence and we balance all the risks and potential outcomes with the patient preferences and values. And what this really means is it's not one size fits all. And it's very important that we look at this more carefully. So there have been a lot of evolving resources in the shared decision-making realm. I just went on, of course, to the internet to find a few, and I found this nice chart from 2013. Unfortunately, all the resources that you try to click on that now don't go anywhere, so it hasn't been updated. So then I found one from 2016, and again, some nice updates were made, but it still had some links that weren't valid anymore. So if you find some of the older resources, you have to make sure they're up to date. At this point, the last thing you can see, I really like the word, share, and that is the steps that your healthcare provider should know how to do. But I think it's just as important for you as a patient to understand what these steps are. So it's about seeking, the participation. And this is, again, as a healthcare provider, I need to ask my patient this way. I have to help explore and compare treatment options. So if you see all the books back there, if you ever went to my clinic, I'm the one bringing the books out and I'm on the computer with you. Then we have to assess your values and preferences. And that means it's got to be appropriate for what you believe and in your heart, and the capacity that you have. We come to a decision together, and then we evaluate that, particularly as your care goes on. And so I'm going to turn it over to Julia in a moment, because she has this wonderful story that she's going to talk about that really shows what a progression it is that not only patients make, but even clinicians as we grow in our care of people. So Julia, go ahead and take it away.
Thank you, Maureen. So yes, here on the slide, you can see the benchmarks of the evolution of what we're going to be talking about today. And so you can see my little sort of light bulb at 2002. And this is really where my initial passion was founded. I've been practicing as a physical therapist like the others prior to this. But on a particular day in that year, I received a patient with a breast cancer diagnosis, and she began to really open my eyes to understand the sort of varied and multiple needs of this patient population, as well as really understanding that I needed to understand the intricacies of the lymphatic system and lymphedema. So I today am extremely thankful to a patient who really kickstarted this journey for me. And so as I began to grow in my practice, I began to really step into managing lymphedema. And between 2002 and 2009, a lot of the practice at that time was centered around trying to mitigate the onset of lymphedema. I realized that I was receiving a number of patients into my care with an existing diagnosis of lymphedema. And it became very apparent to me that there was opportunity to try to get patients in with us at an earlier time frame so that we could begin to work with the patients in their recovery from surgery, from chemotherapy, radiation, whatever the treatment trajectory of the patient was or is, and really try to do all that we could to mitigate the onset of this situation. And so that really was a very large growing point between 2002 and 2009. It was very patient-centered, so I really worked hard to get patient engagement in this process. It also involved a lot of work with physicians to open their eyes to the possibility that we could mitigate the risk of lymphedema, and to really invite their participation in this by beginning to encourage the opportunity for early referral. In other words, starting care as early as possible. And so a lot of that groundwork was set between 2002 and 2009. As physicians began to understand that there was this opportunity with managing essentially the lymphatic system, and as patients, particularly in my local community, began to understand that there was a resource for themselves, and they began to be able to self-advocate within their support groups and with their greater support systems, that there was this opportunity, the practice began to grow to such an extent that in 2009, I established Oncology Rehab. And the idea of creating and establishing Oncology Rehab was to provide greater opportunity for patients to receive care for multiple different types of cancer diagnoses. So breast cancer being one of them for sure, but also head and neck cancer, colorectal cancers, thoracic cancers, your blood-based cancers, etc. We wanted to provide opportunity for all patients to receive care, and across all the different tumor sites for patients to receive the opportunity to reduce impairment. And in the case of this seminar, particularly talking about reducing lymphatic impairment. And so in 2009, this is really where we began to head up this, this goal to really get engagement from patients, from rehab therapists, and from physicians. And at the same time, this is when the prospective surveillance model for lymphedema risk reduction also began to evolve. Really in approximately 2010 was the inception of this. And so we began to implement this model, and still do so today. Essentially, we've been able to evolve this practice with clinical research that has continued to be available to us over the years. And what has also been very beneficial is advancing technology, particularly Lipedema, that has been very helpful in providing SOZO, which you're going to see a slide about a little bit later, that helps us with this surveillance model of care. And ultimately, what we've been working really hard on doing is providing education to clinicians to kind of set the standard of this care, but also to really help them also begin to engage physicians and patients in this care paradigm.
And Julia, this is the slide. I love this, your next slide that you created, because this is really, you know, and it makes me think of like how we've known each other for so long and when we met at conferences. And I just always remember you, it was always about, this is what we're going to do for the patients. And so I'd love you to just talk about this for a moment and really how the patient's at the center.
For sure, Maureen. So if you look at the slide, the first piece that I want to bring your attention to, Maureen's put a cursor right there, is use concepts of shared decision-making. And so this really sets the platform for all of us to be part of managing the lymphatic system and the risk reduction for lymphedema. And so that's what you want to think about as being your starting point. The next thing that you want to do is join a support group or an advocacy group like Learn, where you can gather information and really enhance your own education about your lymphatic system and how to take care of it. Amazingly, the lymphatic system is a system that has a potential to recover from surgery, chemo, radiation, to actually restore some of its function. And so really educating yourselves through the Learn website and other opportunities that you're going to hear about from Christine and Denise would be extremely important. Because what you do want to do is, with your team, your multidisciplinary team, you want to be able to identify if you are at any kind of risk for getting lymphedema. You want to be able to understand what those risk factors might be. You want to be able to understand how to enhance your opportunity for optimal recovery as you move through surgery, chemo, radiation, and you want to be able to empower your action. To do that, you want to be able to speak to your greater team and really engage in surveillance.
I think,
so that's
oh, I'm sorry.
model.
Yeah,
Go ahead,
yeah. I mean,
Maureen.
I think that's wonderful, Julia, because you're really hitting on it's about that engagement that we're creating. And I know, Chris, when we were getting ready and preparing for this, you really talked about how you've done it in your community. So, Julia, are you okay if Chris starts talking about that a little?
Absolutely.
Awesome. All right, Chris, I'm going to let you pick up here, and I'm going to move the slide along. So take it away.
All right. So Julia definitely has wanted us to be empowered with all this knowledge and education. And the reason why I'm on this talk is because I work in Baton Rouge, and Baton Rouge, being in the Southern Belt, has got very high risk of cancer, of all the cancers, especially breast cancer in the African American area. We also have, of course, the worst heart disease. We have obesity. So we have all the bad things. So we have a major medical issue going on, and especially in the South and Baton Rouge area. And looking at lymphedema prevention is, how do we start? Where do we go? I mean, there's so many questions out there. And if any lymphedema therapist out there is asking their question, basically I sat down and said, okay, what do I need to focus on? Where's the best area I could focus on, and who can be my champion doctor to help me with this? And I had just gotten back from a national lymphedema conference in the early 2000s, where there was a radiation oncologist who was the keynote speaker, and he was talking about how they, as a radiation center, looked at lymphedema prevention. And I was like, dang, that's the easiest thing to do, because radiation center is a local point in the hospital. It's a focus point. Everyone knows where it's at. So when I came back from the meeting, I met with the radiation oncologist, and they were so eager and passionate along with me on looking at doing lymphedema prevention. So in the earlier days, before impediment came, we were doing circumferential measurements, or we were doing volume measurements. And I had radiation doctors doing circumferential measurements, trying to help do lymphedema prevention. And so we kind of evolved from that to finally getting the LDEX. And so we're doing lymphedema prevention at in our radiation center. And so we knew we were missing a whole other component. And so being in the hospital work at the Baton Rouge General, it is a community-based, not-for-profit hospital. And we are so involved with so many stuff in the community. I said, well, let's reach out that way. And so in Baton Rouge, which is, even though it's a small little town, we have tons of support for any patient in many different medical areas, but especially cancer. And we have 2 African-American support groups, Sisters and Sisters Network, who I've been actively with them, meeting with them, going out and doing education with them, doing a little bit of lymphedema screenings with them as well. And then we have a breast cancer support group just called Hope Chest. And then we have a young support group for breast cancer women called Survive That. And I know that there's not very many throughout the US, but Baton Rouge, we do have it for young women under the age of 45, because we know breast cancer risk is getting the younger women. And we know the more risk factors that they have, that also is the risk factors for lymphedema too. And then of course, there's Look Good, Feel Better classes that I've been involved with, and plug in that lymphedema prevention anywhere I can in all of this. And some of the areas that's not listed, is the prostate support group that our hospital hosts. So I go to those meetings and make sure the education is there. And then I forgot the best support group on there is at our hospital and our clinic. We host a lymphedema support group, and we invite any cancer patient that has any question to come to these support group meetings, because our support group is more on education and empowering the patients who have the risk of lymphedema or have lymphedema to be better educated so they can be their own advocate when they go back to the physician.
Yeah, I think that's great, Chrissy. You know, a question just came up here. I'm going to just answer it because it's kind of what you were talking about. And someone said they've been using L-Dexozo since 2011, and they see their patients pre-op, 1 month, 3, 6, 9, and 12 months post-op. And they asked if there's literature available to establish different guidelines for follow-ups. And I think most of us have heard of the PREVENT trial now, right? And you know, we can maybe talk about that a little bit, but it was the largest randomized controlled trial that was done with over 1,200 patients, and it was all breast cancer patients. But they followed them for 3 full years and did surveillance that long. And I think, is that something you've found with patients, you know, that they're surprised how long that maybe they need to do surveillance? Can any of you kind of comment on that right now while we're talking about that?
So it amazes me how there's a 5-year in a lot of patients' mindset, and I don't know where that came from. And that's always the first thing I have to tell them. Oh, I'm sorry, it's not a 5-year plan. This is a lifelong prevention idea. And so yeah, it's prevention is forever. If the minute you have a cancer medical treatment that has the risk factors of the lymphatic system being impaired.
And I think that's a really important thing to get out to everyone. And that was really the crux of some of the talks at the last 2 days of webinars that the NIH sponsored about all the research that they're doing. And they're basically saying, like, cancer-related lymphedema, we know it's coming, and that's why there's such an emphasis on trying to, you know, prevent it, or prevent, you know, the progression of it to a more serious state. And you know, there was talk about, even if someone already has lymphedema, so let's say you have primary lymphedema, potentially your risk could be higher if you undergo cancer treatment because you already have some issues with your lymphatic system. So I think, you know, a lot of interesting things are coming up with that. And I think it's questions that I know I would get a lot. I wanted to go, can I switch to your next slide? Because I think maybe you could talk a little bit about even healthy habits and some of the other national supports that we're working with.
There is, if you ever Google support groups or support for cancer, the list is so long. And I just narrowed it down to the basic ones that are the most common knowledge out there, to just make sure that everyone knows that the ones that are listed on the site all have lymphedema prevention mentioned in their on their website, and actually some information to educate you about that as well. And then the strongest lymphedema support out there is the National Lymphedema Network, as well as Learn. And Learn has also taught me many things, because all the webinars and education seminars that they have, it's so much knowledge that they share. And so I definitely want to give kudos for Learn to keep up with that. But the healthy habits that you see in the slide is done by the National Lymphedema Network. And what they did is they compiled the research that's been out there for the last umpteen years that all have, like, don't do this, don't do this. If you're a risk factor of getting lymphedema, don't do this. And they compiled it together to really look at what the research shows. And so that's what they put out. It's called the healthy habits. So if any patient has a risk of developing lymphedema, you basically want to live a healthy lifestyle, eat well, sleep well, take care of yourself, keep up with your doctor's appointments, and make sure you regularly get your checkups. And skincare is, I think, the consensus of all of us in the lymphedema world know that skincare is the most vital component. Taking care of your skin and making sure that you prevent dry skin, you keep your skin moisturized. And then the next step, which is the infection education, make sure you understand how your lymphatic system plays in the fighting of the way it can fight getting an infection, and the way you need to keep your immune system and your lymphatic system healthy. So that way it's not always trying to fight these little skin breaks or these bug scratches that you get. And so infection education is the biggest part of any lymphedema therapist training with any patient that has risk. And then research, I'm sorry, someone saying something?
Oh, I was just going to say something. There was just a great comment though on this, Chris, is that someone just said, thank you for your statement about lifelong surveillance. I'm a nurse CLT and met my first 47-year breast cancer survivor this past year, and she developed breast cancer related lymphedema at 40 years of survivorship. So again, I think wherever our patients are in the continuum and survivorship, we need to make sure they're aware that they're not, and someone else said, I always hear the surprised look when I reference the prospective surveillance model needed. So I think for anyone out there right now, if you're, worried about cancer-related lymphedema and that your medical team is saying, oh, it's not a problem, we're telling you it can be. So, it's not to scare you, it's to get you informed, because that's what shared decision making is all about. So thank you for those comments. And Chris, any other things you can say about these resources before I let Denise talk a little bit about her process at Lee Health?
No, just grab a hold of these resources. Make sure you use a resource that is valid. Don't go on Instagram and start reading everyone else's stuff. But and Julia and Denise both in their talk mentioned that support and this education that these resources provide us is a vital component of empowering your knowledge so that you can be an advocate to the medical community.
Yeah, no, I think that's great. And, hopefully you've taken some pictures of these resources, you know where to find them. The best thing is when you go on Learn's website, you can get links to other resources as well. All the groups were trying to work together, but Learn's site is just phenomenal for getting that information. So Denise, I'm going to let you jump in, and I love this chart. I'm going to let you start to work people through this. It's a little complicated, and go ahead.
Okay. So first I want to say, I find it truly fascinating to see the different dynamics of different approaches to educating patients, to shared decision-making, to multidisciplinary approach. And truly, Julia, you talked about what the stepping stones have been to help patients become their own advocate, which is virtually what Rehab Navigation assists patients in doing. So this really kind of ties into that whole concept of what we're talking about. This is obviously our flowchart form. So Rehab Navigation, it's a non-charged appointment. You meet with any and all patients who have a cancer diagnosis. This is not breast cancer. This is all cancer diagnoses at the earliest point in their diagnosis, so that they can be provided with education and a contact person, help to identify, monitor, and mitigate cancer-related impairments throughout their diagnosis, their treatment trajectory, as well as their survivorship. So it's that ongoing contact point. So as the navigator, what that allows you to do is certainly look at all aspects of a patient's current status and identify those needs, and then connect them to the multidisciplinary team. And again, that's what we're talking about. It's a tribe to be able to provide optimal care. And from there, as a navigator position, I can procure referrals to all of these different services. And truly, it's pretty extensive. It's not just the rehabilitative component, but also our palliative component, connecting with pain and symptom management, nutritional guidance and counseling, support groups, smoking cessation, and certainly cardio-oncology, which is a whole nother topic we could talk about from the toxicity of treatments. But the center of it being giving patients the ability to have that confidence in being able to approach their providers, because they're educated on what they should be looking out for. And yes, they can be improved through rehabilitation, lymphedema, identifying it at its earliest point, like we do through our surveillance program. So I love that idea, and it has started years prior. The difficulty I think we all experience is that not all providers have that awareness. And I think as medical professionals, not only are we educating our patients, but it's so important to continue to reach out to our medical team, our oncologists, our surgeons, and help our patients make those needs known, so that it's not a reactive referral to rehabilitative services or lymphedema. It's proactive. Let's educate, let's prophylactic measures, and be a little bit more ahead of the game rather than the traditional idea. So does anybody have any questions in terms of that flow chart?
I mean, I'd like to hear from everyone else. I just love that it's spelled out. It's so clear, so you know what the path is, and also that you've done some research about this as well. And this is something that other people could look at the research, correct?
Correct. And most importantly for our viewers and our patients, it's so vital to be able to ask, what are my support resources? Do you have a navigation program? Is there someone who can be my main contact? And I think that, again, having that voice to be able to say, I know I'm going to have needs. Who can I speak to about this?
Yeah, no, I think that's great. Julia, Chris, any comments on that? I think, there's a, it's more of a question or a comment coming through right now that we can't talk about any specific healthcare providers. But it's basically just saying it's kind of tough because they're being told it's only been done one way. What should we talk to patients? How should we counsel patients when they're working in a system that's saying it's only this way?
That can be quite a challenge. It can. From a personal experience, we do have a team. And certainly if I find resistance or a lack of support for a referral for a patient, I will even reach out to their primary care provider to be able to get that support to get services for the patient. So I think there's different routes we can go, but it's being able to develop those relationships with our whole team. Yeah.
Anyone else? Any other comments on that? Because I think this is one of these. I don't know. Sometimes as an experienced provider, I would get people come and sort of share experiences like this that perhaps it didn't go in the pathway they wanted it. And so I think something like this is great, though, because I would tell someone to please share this with the facility you go to and say, we can do things differently. And I think that's why we're all advocates in this space.
Yeah, I want to thank Denise for showing the slide. As our center is moving towards a prospective model, I kind of cheated and used some of Denise's ideas on this slide. So thank you.
Good. That's great.
Yeah, and sorry, go ahead.
Oh, no, go ahead, Julia.
I was just thinking about, the situation where within a system it may be done in a particular way. I think the thing to understand is that this is evolving. What you're hearing from Chris and Denise is still evolving practice. And not all physicians and clinicians and other, care team providers are specifically up to date on absolutely everything. And so part of today is to help you as the patient understand where we are. Where are we today in 2020? What resources are available? What are the resources saying? And what are different care models looking like? So that you can take that back to either your physician or your primary care provider, or if you are working with a therapist, to that therapist who can then take it to other people within your entity to help grow it. We certainly understand that it is very difficult to do that, but those would be some of the avenues of opportunity that you could take from today.
I will mention, Julia, and to the panel as well, that we are working on a national level with our leading cancer research person, Nicole Stout, on creating a process to help all systems that are willing to create this rehab navigation model so that we can provide that initial contact and have surveillance throughout their whole journey. So it is evolving without question.
And then
And I think that's, oh, go ahead.
what I was going to say is if any patients are out there and their current hospital system or their current oncology does not have this type of model, to hang tight. It is coming, because the NAPBC, which is the National Accreditation Program for Breast Cancer Centers, as well as the COC, which is the Commission of Cancer Commission, they are actually putting out standards that's saying you have to have a survivorship plan, you have to have a navigator plan, you have to have lymphedema prevention. So the standards, the accreditation places that give us the accreditation and the titles of being a cancer center is telling us we have to start doing this stuff. So hang tight, guys. It is coming if you're a patient that facility doesn't have it.
Yeah, and really, if this is the first time you're hearing about something like, Rehab Navigation or Cancer Navigation, it is because, again, Denise is one of the leaders. That's why I got her to come on this webinar, because Nicole Stout was one of my mentors, and I've been following her work for years. And so all over the country, we have places, University of Utah, Chris is doing, one of the PTs there is doing embedded PT and navigation, and it's happening and springing up all over. This is what Julia's group is doing. This is what Chris is trying to do. And that's what we're here today. And we have to remember that the Learn Centers of Excellence have been working for years now to grow and really be a support for patients with any type of lymphatic disorder. So the whole spectrum of lymphatic diseases. And it's really important that we understand, that the resources are out there. So, I'm going to go to your next slide, because I think this is going to really get us into the Q&A well, Denise. And I just love this slide. It's very similar to Julie's in one way, but this really talks about all the different potential people, right, that you could reach out to on your team.
Absolutely. And multidisciplinary being that it takes a little bit from every aspect of every provider to be able to meet the needs of our patients. So if there's a component there that is missed, we want that team of providers to be able to recognize it. One can refer to the other to cover those needs. And that's really for patients to be able to have a team that works cohesively. It is truly optimal. But again, as the others have said, it is not always available. So that's where gaining that education and confidence to bring it to your providers is really, really important.
Yeah, I can't agree more. And, I think there's some questions coming up in the Q&A here that that kind of speak to some of this and sort of what our next things that we need to do. I'm going to advance the slide ahead one, I think. Are we okay moving ahead off of this slide? Mm-hmm. So, this is one thing I'll just kind of put in my little plug for ImpediMed is if you're a patient out there and at risk for lymphedema from cancer, please go on our website, and we have a bunch of information for you, and it's information you can learn about the research and also share with your physicians. Now, you can also even find an LDEX provider. That is someone you select what country you're in, obviously US here, and you would put your zip code, and you'll find the nearest provider. But all of our information is geared either towards you as a patient so you understand what can be done, and stuff that you can give to your doctors. And then I'm going to leave it hanging out on this next slide as we start to go through the Q&A, because this is really, the incredible resources that Learn has are just amazing. Everything from the newest awareness campaign that they're going to be having Kathy Bates and Steve Gutenberg, two famous actors who are going to use their faces and voices and personal experiences to share the story and be out there on TV and radio and whatnot. And then we have great resources like 10 things I want my physician to know about lymphedema. So you can kind of watch that as we start to ask questions. And there are so many good questions here. I'm going to start from the top of the list, and we're going to try to get through as many of these as we can. And panel, jump in whenever. But we already talked about there is a recommended interval for surveillance for cancer-related lymphedema, and that is every 3 months for the first 3 years, then twice a year for 2 years, and then once a year after that. There's a question about athletic compression garments, and I would say please go to Learn's website. We can't give advice, but typically athletic compression garments are not medical grade, and so we would never recommend those as clinicians. And thank you all for being lymphedema angels. We appreciate that. We really do love what we're doing, which is why we're here. There was a comment about being in Hawaii and having a hard time finding care. And I believe that Learn may have a state chapter in Hawaii now that just started. Does anyone know? Or if you can put in the chat, Colleen McGuire, let me know, or if you want to come on. But if so, look to Learn and definitely find their resources. And if not, who wants to go to Hawaii? We'll start a chapter there. So we're going to try to get back to that a little bit more. Someone did have a question about, does cellulitis come on quickly? And Christine, I want you to talk about that a little, because you talked about how important skincare is.
I'm sorry, what was the question?
It was like, how, is there any info on the sudden onset of cellulitis with lymphedema? So anyone who wants to answer that, where does it come from?
So research has actually shown that if you don't have lymphedema and you develop cellulitis, and that is one of the triggering points that can lead into lymphedema, because it impairs your lymphatic system, so it weakens your lymphatic system, so then you have the ability to start building up fluid, which is the lymphedema. So that's the reason why skincare is vital, just taking care of your skin, which as adults we tend not to do. If we get a paper cut, we're sucking it and going about the business, So I tell any cancer patient, you got to take care of your skin. You're always going to be at risk of developing some kind of infection from a basic little cut where beforehand you were not. So, and that's just keeping your arm or keeping your skin lubricated. Keep the skin lubricated, because a lot of the chemo medicines tend to dry out skin. And then if you get a nick, prick, or bug bite, take care of it. Don't ignore it like we normally would have. And being in the South Louisiana, the mosquitoes are so bad. So we have to make sure we live in a life of taking care of using repellents and making sure those mosquitoes not biting us.
Julia, what do they train in Pori about that?
Well, so really part of it, Chris has answered absolutely beautifully, but part of it is that the lymphatic system is part of the immune system. And so when you develop lymphedema and you have a swelling in an extremity, part of your extremity's immune response to things like cuts and insect bites and sunburns is reduced. It's a bit immunosuppressed, if you will. And so that then increases the vulnerability to getting infection. And so, Irene, to answer your question, just from an additional little piece of information there, that's partly the reason, is that you've got some immune suppression because of lymphedema. And you've also got an accumulation of fluid there. So when there's injury, infection can get in quite easily. So looping back to everything that Chris has said about skincare and how to mitigate cellulitis becomes very important.
That's I couldn't say any better, and just how important that is. I want to jump to, and so hopefully for the person who said my skin is hardening, that's why you need to get to see someone who can teach you about skincare. It's not something we just learn on our own. We really have to, it's one of the most important things we can teach, and someone should be able to help you. Denise, there was a great question. This is actually from a CLT, an OT CLT.
Okay.
And was the idea an eventual framework for the Rehab Navigator designed from the top down or bottom up? I work now for a hospital system that's similar to Lee, and I've heard of pushback from the top and wondering if pitching, so to speak, the concept to patients and oncologists and drive the movement through the patients, similar to what you folks were just discussing. And if you could also comment, whoopsie, I didn't mean to turn my slide. I was trying to get back to the questions, but there was also someone who asked, did you replace the nurse navigator or do you work alongside?
I'll answer that part first. We work alongside, absolutely. It's all collaborative. I work very closely with all the nurse navigators, especially the breast nurse navigators, because we have a breast clinic every Friday where at least 5 to 6 new patients come in and they meet with the med-onc, radiation oncologist, surgeon. They are measured on the SOZO to get an LDEX score prior to any treatment. And, that follow-up happens at all points in time of their care. So yes, that is collaborative. As far as developing the program, it started out as 8 hours a week. And through finding champions in our administrative who could actually see the value in it, it took quite a bit of time to be able to prove the benefit, because it is a non-direct revenue generating position. We had to create a platform to show that, yes, this is valuable because we are identifying needs that patients have, and they are getting to those therapies much sooner and more effectively. So once that was able to be demonstrated, then there was definitely more buy-in from our administrative component to support that.
That's awesome, Denise. And, it makes me think of it just sitting here that with the Learn Centers of Excellence, I don't even know if they have lymphatic navigators, but I've always thought, right? Haven't you kind of in your wish list when you're trying to sleep at night and things aren't going right for your patient? You're like, why don't we have navigators for this? Maybe we start to create lymphatic treatment navigators.
Definitely. And even through your breast surveillance program, that is what you're identifying, the need for that lymphatic treatment through your measures as well. So definitely could specialize in a lymphatic navigator.
Yeah.
Can I quickly
go ahead.
interject?
Oh, please.
Yeah. Maureen, thank you. So just as Denise was pointing out, you've got sort of advocacy opportunity, and it goes from the bottom up, but also the top down. And so to answer your question about some of the top down, I'm going to just refer back to something that Chris said earlier, and that is to be aware that the NAPBC, as well as the COC, the Commission on Cancer, actually have policy and procedure in place for facility administrators, hospital administrators, to ensure that these services are available and provided, particularly if a facility or hospital has a cancer service line. So there is some advocacy that you can approach from the top down, using leverage from entities like COC, etc.
And that's true for the program as well, because that's how rehab was brought into it, to be able to get COC credited. Absolutely.
Yeah, and I think this is, there's a number of questions coming up about, what happens, any suggestions when there's payers and policies that limit your services and things like that. Join, learn, get involved. This is what the Learn Centers of Excellence and all the work we're trying to do is geared towards. So please get involved with that. And with that, again, when not having access to care due to insurance constraints, please get involved. Reach out to support groups, reach out to learn, and you have to go back to your physicians and advocate for yourself. And so whether it's coming up with that list of things that still haven't been dealt with and talking to them, that's part of that. So I know it's tough out there, but really it's a growing network. So please reach out though. There are a couple other questions. Let me go down through. Go ahead, Chris.
Sorry. As far as the financial and the LARN is a big supporter of the Lymphedema Treatment Act that we have been pushing for the last couple of years to get better coverage for compression garments for those Medicare patients. And I followed along with that, and we were able to get Louisiana State passed a bill very similar to that to get better coverage for people that have lymphedema needing any kind of compression products as well too. So even though you might not have the coverage you need now, it's, we can do it, we can work on it, and LEARN is a big supporter on anything that we can do to help get the coverage better and help get the insurance to look at changing their mind. Massachusetts did, the doctor single up there at Harvard, they did a major change with the Blue Cross Blue Shield policy on getting things covered up there. So it can be done. It's just a lot of work, but hang tight, we can work on it and do it as a big group together.
Yeah, no, I can't echo that anymore. And Julia, someone asked for the COC references. If you actually go, they're in the guidelines there. If you just go to their website, correct?
Yes, and in terms of rehab, it's standard 4.6 that you want to look up. That's for rehab specifically, and for survivorship, it's standard 4.8.
Very good. All right, let's just check. There are some good, remember to go on lymphaticnetwork.org for any of these resource downloads. The website has so many of these resources here. The Hawaii chapter is transitioning, I just found out. They are looking for advocates to lead and join for the upcoming year. So my person from Hawaii, contact Learn, please. And there's, you can see the chapter list that you'll be able to get connection to. All right. All right. Oh, what is the COC website? And that should just be Commission on Cancer, correct?
Yes.
Yeah.
Correct.
Okay, no worries. That's done. How to educate your primary care and ER docs to refuse treatment of lymphedema patients, quite literally. What should you do? This is happening, I can't say where on air, but show them this 10 things you want physicians to know. And again, advocate through Learn. And, you know, all hospitals actually have patient committees that you can bring information to, especially if you're having a problem. Any thoughts, Denise, or from
Yes,
your end in terms of navigation, or Julia?
if you have a physician, we're going to call that person a physician champion who understands your lymphedema. Make sure you've got their number available so that if you do end up in the ER and you're with somebody who doesn't fully understand it, they can actually connect with your physician who does. That may be an idea for you.
Correct.
And then if you don't have a primary care physician, if that was a question, a vascular doctor, you know, go get a second opinion somewhere else of someone who at least understands a little bit more of the lymphatic system. And so we always encourage patients to go see at least a vascular doctor and get the veins tested and double check, and they understand a little bit about lymphedema.
Yes, we utilize that approach here too in terms of vascular. We have quite a bit of referring providers just for vascular lymphedema as well. So I agree, that's a nice approach too.
Yeah, no, I think that's great. And, you know, someone mentioned that if we could mention something about lipedema, and honestly, you know, everything's the same that we're talking about in terms of shared decision making. It's the exact same approach, and it's through education. And really, if anyone you see up here talking to today, we all realized at some point in our career, and this is kind of my final statement, that education was so important to us. It really was the key to everything. You know, the education that I received about the lymphatic system. And so, you know, if you think about the takeaways that we have here, before I let everyone else kind of say goodbye and I answer some of the final questions, but we have to think like a navigator, really what Denise was talking about. We have to almost have that flow chart for ourselves. And then we have to bring shared decision making. I was famous for making my patients write things out about what was important to them. And they'd be like, really? Aren't you going to just tell me what to do? I'm like, no, if you're not a partner with me, I can't make this happen. And I can't emphasize how important it is to join, learn, support them. Again, you have to join the fight to win the fight. They have so many resources, but this doesn't happen for free. I know lymphedema is not cheap to take care of, but we have to support our organizations. And again, it's all about bolstering communication, you know, really each and every day, even with ourselves. Sometimes it's that self-communication that we even talk to ourselves when we're dealing with a chronic condition. So, you know, with that, I'd like to just have, you know, Christine, then Denise and Julia, just give me your final kind of comments. And I'm sorry if we didn't get to some of the questions about specific treatment aspects, but we couldn't really do that on here. Feel free if anyone wants to email me about getting a resource. Let me just quickly put it out here, but it's mmcbeth@impedimed.com, and or just contact Learn and they'll get your questions to us and we'll try to answer that for you. So go ahead, Chris, your final statement. Of the
You're a patient, and I tell all my patients, you know your body best. And if you have any kind of changes or any kind of symptom or sign, be an advocate and make sure you get the answers to any of the medical team that you go to about what's going on, or get the care that you need. And as a therapist, you know, our vision is to be like Denise and Julia and get to how they're working in their areas. And I'm not there yet. We're working towards it, but I've learned you got to do small steps to get there. And, you know, Julia and Denise, they didn't get there overnight. It took them years to get to them being where they're at in their careers and the wonderful care that they're doing. And to get there, just do small steps and, you know, win those little small battles with a physician champion each time.
Agree. And as far as, you know, what I just want to add to that, the biggest takeaway, I think, overall is that, yes, the whole idea of oncology, rehabilitation, surveillance, everything is moving towards a more standard of care, that these services will be a part of a care plan. And as clinicians, I think, you know, we need to keep in mind that, yes, our goal is to continue to educate our patients so they have a voice, our providers, so that they are aware that these, you know, impairments can be mitigated. So keeping in mind that we don't want to neglect that opportunity to help patients foster living well with a cancer diagnosis.
Julia.
Yes, very well said, both Chris and Denise. And what I'm going to say to those of you who are patients, know your system, educate yourselves as much as you can about your system, about your condition, if it's lipedema or primary lymphedema or secondary lymphedema, and protect your system. It's your system, it's part of your body, and you have every right to protect it, to advocate for the right type of care. And we're here to help you do that. And as the others have pointed out, the resources are there for you as well. And so that's what I would encourage all of you to do.
Well, we just want to thank all of you for joining us this evening, and for this esteemed group of panelists, for everyone at Learn, for what you're doing to make LE something that patients can manage and actually have resources and everyone know about it. We want to thank you again. Good night.